A radiology technician, often referred to interchangeably with radiologic technologist, is a trained healthcare professional responsible for capturing diagnostic images of a patient's internal anatomy using various types of medical imaging equipment, such as X-ray machines, CT scanners, and fluoroscopy devices. These images assist physicians in diagnosing and treating medical conditions effectively. While the terms radiology technician and radiologic technologist are sometimes used interchangeably, a radiology technician typically refers to professionals who perform fundamental diagnostic imaging tasks, often focusing primarily on X-rays and basic procedures. Regardless of the subtle distinctions in job titles, their work remains pivotal in delivering high-quality patient care and accurate diagnostic support. This video provides a comprehensive overview of the job description of a radiology technician, highlighting the scope of their duties, the essential skills required, educational pathways, and the broader impact they have within the healthcare system. Overview of the role. The radiology technician's role is deeply rooted in the intersection between healthcare and technology. Their primary task is to produce clear, diagnostic quality images that help physicians identify a wide range of health concerns, from broken bones and pneumonia to tumors and blockages. In performing their role, radiology technicians must not only operate imaging machines, but also position patients correctly, ensure radiation safety protocols are followed, and maintain a comforting and professional demeanor. They are often the first point of contact for patients undergoing diagnostic tests and must be skilled in both technical operation and patient care. The job description of a radiology technician emphasizes a dual focus: technical mastery of imaging equipment and compassionate interaction with patients. This balance is essential in ensuring accurate results while minimizing patient discomfort or anxiety. Roles and responsibilities of a radiology technician. The daily responsibilities of a radiology technician extend beyond simply taking X-rays. Their role requires a comprehensive understanding of anatomy, radiographic procedures, and patient care protocols. 1. Preparing patients for imaging procedures. Radiology technicians begin their tasks by preparing patients for the imaging process. This includes explaining the procedure, confirming identity and physician orders, and answering any questions the patient may have. Depending on the type of scan, the patient may need to change into a gown or remove metal objects that could interfere with the imaging process. Technicians must ensure patients are positioned properly, as incorrect positioning can lead to poor image quality or misdiagnosis. Comfort, safety, and communication are key in this initial phase. 2. Performing diagnostic imaging procedures. The core function of a radiology technician involves operating imaging equipment to capture internal views of a patient's body. This commonly includes 1. X-rays, used for imaging bones, chest, abdomen, and other body parts. 2. Fluoroscopy, provides live motion X-ray imaging, often used during procedures. 3. Portable radiography, for patients who cannot be moved to the imaging department, such as those in intensive care units. While more advanced modalities like MRI or CT are typically handled by technologists with additional certifications, radiology technicians focus on ensuring that basic imaging procedures are executed with precision. 3. Ensuring radiation safety and compliance. Radiology technicians play a critical role in minimizing unnecessary exposure to radiation. They must follow strict safety protocols, including 1. Using lead aprons and shields for patients. 2. Wearing personal dosimeters to monitor their own exposure. 3. Adjusting machine settings to use the lowest possible radiation dose while maintaining image clarity. Compliance with federal and institutional radiation safety guidelines is a non-negotiable part of the job. 4. Handling and maintaining imaging equipment. Radiology technicians are responsible for the daily operation of imaging machines. This includes powering up systems, calibrating settings, and performing regular checks to ensure everything is functioning properly. They must recognize signs of malfunction or wear and report these promptly. Some technicians may also assist in the preventive maintenance of equipment or work with biomedical technicians when more complex issues arise. 5. Managing and processing image data. After capturing the images, technicians are responsible for uploading, storing, and forwarding them to the radiologist for interpretation. This usually involves using a picture archiving and communication system, PACS. Radiology technicians must ensure that images are labeled correctly with patient information and that documentation is complete. Maintaining the accuracy and confidentiality of medical records is a vital aspect of their responsibilities. 6. Supporting emergency and trauma care. In emergency rooms or trauma settings, radiology technicians often work quickly under pressure to capture images for rapid diagnosis. They must be able to function calmly and effectively in high-stress situations, especially when patients are in severe pain or distress. Quick thinking and adaptability are essential, especially when portable imaging equipment is used at the bedside or during emergency procedures. 7. Collaborating with medical staff. Radiology technicians frequently interact with nurses, radiologists, and physicians to coordinate care. While they do not interpret results, they may be asked to retake images or adjust techniques based on physician feedback. This collaboration ensures that imaging supports accurate diagnosis and timely treatment decisions. 8. Providing patient-centered care. Patients may feel nervous, claustrophobic, or uncomfortable during imaging procedures. Radiology technicians must demonstrate empathy and professionalism, offering reassurance and explaining each step clearly. A patient-centered approach contributes to better cooperation, clearer images, and overall satisfaction with care. 9. Adhering to protocols and ethical standards. Radiology technicians must operate within established protocols, ensuring ethical conduct, patient privacy, as per HIPAA or similar regulations, and a high standard of clinical care. They must also stay updated with institutional policies and medical advancements relevant to diagnostic imaging. 10. Continuing professional development. As technology evolves, so too must the knowledge base of radiology technicians. Continued education is essential for maintaining licensure, advancing skills, or specializing in other imaging modalities. Workshops, certifications, and refresher courses allow technicians to stay current with best practices in patient care and imaging technology. Skills required for a radiology technician. To perform effectively in their role, radiology technicians must possess a unique mix of technical and interpersonal skills. 1. Technical proficiency. Ability to operate imaging machines accurately and efficiently. 2. Knowledge of anatomy and physiology, understanding how to position patients based on the area being examined. 3. Radiation safety awareness, knowledge of protective techniques and regulations. 4. Attention to detail, precision in image capture, documentation, and patient instructions. 5. Physical stamina, ability to assist patients, stand for long hours, and move equipment. 6. Communication skills, clear explanations and empathetic interactions with diverse patients. 7. Problem solving, ability to troubleshoot equipment issues or adjust procedures for complex cases. 8. Teamwork, collaborative mindset when working with other healthcare professionals. Education and certification requirements. Radiology technicians must complete formal education and clinical training before practicing professionally. 1. Education. Typically, a certificate or associate degree in radiologic technology from an accredited program is required. 1. Some may pursue a bachelor's degree for advanced roles. 2. Licensure. Many regions require state licensure, which may involve passing a competency exam. 3. Certification. Certification from a recognized body, such as the American Registry of Radiologic Technologists, ART, is often required or preferred by employers. 3. This certification demonstrates competency and commitment to professional standards. Students gain hands-on experience through clinical rotations during their education, where they learn to perform imaging procedures under supervision. Work environment and career outlook. Radiology technicians are employed in hospitals, urgent care centers, diagnostic labs, outpatient imaging clinics, and mobile imaging units. They may work full-time, part-time, evenings, weekends, or overnight depending on the healthcare facility's hours. The environment may require standing for extended periods and working with patients who are immobile or in discomfort. Safety measures must always be followed to minimize radiation exposure. The career outlook for radiology technicians is strong, with demand increasing due to an aging population, growth in medical imaging technologies, and expansion of outpatient diagnostic centers. Employment is expected to grow steadily, offering stable job opportunities across the healthcare spectrum. Opportunities for advancement exist, especially for those who pursue certifications in specialized areas like CT, MRI, or mammography. Conclusion: the job description of a radiology technician encompasses a diverse and meaningful range of responsibilities. These professionals operate at the heart of diagnostic medicine, producing high-quality medical images that are crucial for accurate diagnosis and effective treatment. From mastering imaging technology and practicing radiation safety to delivering compassionate patient care, radiology technicians play an indispensable role in today's healthcare system. They serve as both skilled technicians and empathetic caregivers, helping bridge the gap between medical science and human experience. With continued education, dedication to patient care, and adaptability to technological advancements, radiology technicians can build a rewarding and impactful career in the ever-evolving world of medical imaging.